GOUT is an musculoskeletal disease. Look at this picture, shows that CT findings, MRI and X-ray findings. Look at this. Detail going on. Introduction. GOUT is a common and complex form of inflammatory arthritis characterized by sudden severe attacks of pain, swelling, redness and tenderness in the joints, often the big toe. It results from the accumulation of urate crystals in the joints, causing inflammation and intense pain. It is one of the oldest diseases known to humanity and can significantly impact a person's quality of life if left untreated. Definition. GOUT is defined as a metabolic disorder leading to the deposition of monosodium urate crystals in tissues, particularly joints, due to elevated levels of uric acid in the blood. This condition triggers episodes of acute arthritis, causing joint pain and inflammation. Types. 1. Acute gout, sudden onset of severe pain and swelling in a single joint, often the big toe. Episodes typically last several days and resolve spontaneously. To chronic gout, recurrent attacks that may lead to permanent joint damage and the development of tophi, uric acid crystal deposits under the skin. 3. Tophaceous gout, characterized by the formation of tophi. These are visible or palpable lumps under the skin around joints, indicating long-term urate deposition. 4. Pseudo-gout. While similar to gout in presentation, it involves calcium pyrophosphate crystals rather than urate. causes gout occurs due to an excess of uric acid in the bloodstream, which can from crystals in the joints. Several factors contribute to this. 1. Overproduction of uric acid. As a byproduct of purine metabolism, uric acid may accumulate due to increased breakdown of purines found in certain foods. Example: red meat, seafood. 2. Under exertion of uric acid. Impaired kidney function can reduce uric acid clearance from the body, contributing to hyperuricemia. 3. Alcohol consumption, particularly beer and liquor, which can increase uric acid levels. 4. Certain medications, diuretics, low dose aspirin, and immunosuppressants may hinder uric acid extraction. 5. Genetics. A family history of gout increases the likelihood of developing the condition. Risk factors. 1. Diet. High intake of purine-rich food, sugar, beverages, and alcohol. 2. Obesity increases uric acid production and decreases kidney efficiency. 3. Medical conditions: hypertension, diabetes, kidney diseases, and metabolic syndrome. 4. Gender and age. Men are more likely to develop gout, especially after age 40, while women are more at risk post-menopause. 5. Medications: diuretics, low dose aspirin, and drugs that increase uric acid levels. 6. Surgery or trauma. These can sometimes trigger gout attacks. Complications: 1. Joint damage and deformity. Chronic gout can lead to permanent joint destruction. 2. Kidney stones. Urate crystals may accumulate in the urinary tract, forming stones. 3. Tophi. Persistent uric acid crystals under the skin leading to lumps around joints and other tissues. 4. Renal failure, long term hyperuricemia can damage the kidney over time. Pathophysiology. Gout arises from hyperuricemia, uric acid 6.8 mg per dl. Uric acid, the end product of purine metabolism, crystallizes when its levels exceed the solubility threshold. These monosodium urate crystals deposit in synovial joints, triggering an inflammatory response mediated by neutrophils, cytokines and interleukins. This results in the classic signs of inflammation: heat, redness, swelling, and intense pain. The pathophysiology of gout involves several steps leading to the development of inflammation and joint damage. Below is step-by-step breakdown of the process. Step 1. Hyperuricemia. Elevated uric acid levels. 2. Formation of monosodium urate MSU crystals. Step 3. Crystal deposition in joints. Step 4. Immune system activation. Step 5. Inflammatory cascade. Step 6. Acute gout attack. Step 7. Resolution of inflammation. Step 8. Chronic gout if untreated. Step 9. Complications. By understanding these steps, clinicians can target specific stage of the disease processes to manage and prevent further damage caused by gout. Signs and symptoms. 1. Intense joint pain, typically affecting the big toe but can also involve ankles, knees, elbows, wrist and fingers. 2. Swelling and redness. Inflammation lead to noticeable joint swelling, warmth and redness. 3. Limited range of motion as the joint becomes more inflamed. Movement may be restricted. 4. Lingering discomfort. Even after the acute pain subsides, mild joint discomfort may persist for days to weeks. 5. Tophi. Chronic gout leads to these urate crystal deposits under the skin, often around the joints. Diagnosis. 1. Joint fluid test. Extracting synovial fluid from the affected joint to identify urate crystals under a microscope. Two, blood test. Elevated serum uric acid levels can support the diagnosis. Though some individuals with gout may not have hyperuricemia during an acute attacks. Three, imaging test. X-rays, ultrasound, dual energy CT scans may show crystal deposits or joint damage indicative of gout. For physical examination, the classic presentation of inflamed joints, especially the big toe, helps in diagnosis. Nursing diagnosis. 1. Acute pain related to joint inflammation and swelling. 2. Impaired physical mobility related to joint stiffness and pain. 3. Knowledge deficit regarding dietary management and medication regime. 4. Risk for infection related to frequent joint aspiration. 5. Risk for impaired skin integrity due to the development of tophi. Management. 1. Lifestyle changes. Weight loss, avoiding high purine foods, reducing alcohol intake. 2. Hydration, increase water intake to help flush out uric acid through urine. 3. Long-term medications for chronic gout, medication to lower uric acid are prescribed to prevent future flare-ups. For patient education, educate on medication, adherence, dietary modifications, and lifestyle changes to reduce the risk of future attacks. 5. Monitor for complications. Watch for signs of kidney stones, chronic joint damage, or the development of tophi. 6. Encourage hydration. Ensuring adequate fluid intake helps reduce the risk of uric acid crystal formation in the kidneys. 7. Pain management. Administrate prescribed medications and provide non-pharmacological comfort measures. Example, cold compression. Treatment. 1. Non-steroidal anti-inflammatory drugs, common first-line treatment for acute gout attacks to reduce pain and inflammation. 2. Colchicine, used to relieve acute gout pain by reducing the inflammatory response. 3. Corticosteroids, oral or injectable steroids, are used for patients who cannot tolerate NSAIDs. 4. Rate lowering therapies, medications such as allopurinol decrease uric acid production. 5. Probenecid helps the kidneys eliminate more uric acid. Psychosocial medicine, one impact on quality of life. The recurrent and often debilitating nature of gout can affect daily functioning, self-esteem, and overall well-being. Two support groups. Connecting patients with support groups can provide emotional assistance and practical advice on managing chronic pain. 3. Psychological counseling, addressing anxiety, depression, or feeling of isolation due to chronic illness may be necessary for long-term coping. Prevention, 1. Dietary changes, avoid high purine foods, example organ meats, shellfish, and reduce alcohol intake, especially beer. To maintain healthy weight, obesity is a significant risk factor, and weight loss reduces the burden on joints. 3. Hydration, drinking plenty of fluid help to dilute uric acid levels. 4. Limit sugar and fructose intake, avoiding sugary drinks and high fructose corn syrup can prevent uric acid buildup. 4. Medication adherence, patients on urate lowering therapy should adhere to their regime to maintain low uric acid levels. In conclusion, gout is a manageable condition with proper medical treatment, lifestyle changes, and long-term prevention strategies. Early intervention is key to reducing complications such as joint damage, kidney stones, and the development of tophi. Education and psychological support are crucial in helping patients manage the physical and emotional impact of this chronic condition. Thank you. Have a nice day.